for lip filler that lasts about 6 to 18 months. Lip flip can last anywhere between 3 to 7 or 8 months, depending on the type. And then a lip lift is permanent. Lip flip gives you the least amount of post-op swelling and recovery time. Lip filler is a couple days worth of swelling and bruising, and lip lift is almost a week's worth of at least having the sutures intact and maybe a couple days of swelling also. Hey guys, that's Dr. Samir Undavia from NJ ENT and Facial Plastic Surgery. And today I wanted to talk to you about how we address the lips. So first, most people think when we're talking about addressing the lips, we're just talking about filler, but there's actually several ways to address the lips. So filler is one. That's where we inject something like Juvederm or Restylane or RHA into the lips. But there's also a second way to address the lips, and that's a lip flip, and we'll get into that in a second. And then there's a third way, which is called a lip lift, which is more surgical. And then we'll get into that also right after. So let's just talk about the most common way, which is the lip filler first. So that's something that we inject into the lip, upper and lower, and we do it in the office. Patients go home or go back to work right away. We typically use a product like Juvederm or Restylane or RHA. I like RHA, it tends to last a little bit longer, but in general, fillers last anywhere between 6 to 18 months. There are fillers that last longer than that, but they're a little bit thick for the lip. And sometimes in the right person, that might be appropriate, but for most patients, it's anywhere between 6 to 18 months, depending on the type of filler they choose. So fillers that last a shorter amount of time tend to be a little bit thinner. And maybe we do that for somebody that doesn't really want big lips, or that has that has a particular lip where we don't want to make it too plump. It'll not fit their face. So fillers that tend to last 12 or 18 months are a little bit thicker, and those lips can be a little bit bigger. Now we can use the longer lasting filler in a lip that needs to be a little bit smaller. We just don't use as much of it. Most patients use about 1 syringe or a little less, but we have some patients who have done like sequentially 2 or 3 syringes. They just want bigger lips, and we can make them into the shape that they would like, but we're limited by the starting configuration of the lip. So not everybody's lips are going to look the same. So it's important to know that you might want a certain shape of the lip, but we also have to kind of fit your shape into what we're doing with the lips. So fillers, like we talked about, you'll go home right away. It'll last for anywhere between 6 to 18 months. Typically for fillers, you are going to get some bruising and swelling. So you get pretty big lips for about 48 hours, sometimes 72 hours. It's best to ice those lips. It's best to have less salty foods. And it always goes away. It just takes some time. Yeah, that's fillers. Lip flip is using a product like Botox or Daxxify or Dysport. And lip flip is nice for somebody that has a very gummy smile and they don't want to see a lot of their gums when they smile, or somebody that really just wants a very subtle change. Also somebody that doesn't want to have the swelling for the 48 to 72 hours. A lip flip is done where, like you're seeing, we inject the toxin right above the red part of the lip and the white part of the lip, or at the border of the red and white lip. And that's most often. Sometimes we can do it here, but I like to inject it more in the center. What it does is it relaxes the orbicularis oris muscle, which will then help define the lip, create a little bit of a vermilion border, and then also show more of the red part of the lip. Lip flip is something that typically lasts 3 to 6 months. Although if you want to use something that lasts longer, we use Daxxify. I like to first figure out the right dose with Botox or Dysport, and then use Daxxify, because if you don't like it, we don't want to have you use something that lasts longer. The thing that people complain about most, but still use lip flip, is that they sometimes can't use a straw at the corner of their mouth. They still love the look, so they do it, but they just say that that's something that, probably is a rate limiting step in how many units we use. We typically use 5 units total. In the patients that want 10 units, that's when they really start to notice that the corner of their lip is hard to use with a straw. Now let's talk about a lip lift. Lip lift is actually one of my favorite things to do. We do it in the office under local anesthesia. Patients drive themselves home. But if we needed to do it in conjunction with like a facelift or blepharoplasty, sometimes we do it in the OR. Although with blepharoplasty, we also do that in the office. Now, lip lift can be many different shapes, but it's typically something called a peri-alar bullhorn lip lift. And that's where we remove about 4 to 6 millimeters right underneath the nose. The incision is tucked up right underneath the nose, so it's really not that visible. Typically, patients will drive themselves without needing Xanax or anything. We have to inject the lip with numbing medication so that they don't feel anything during the procedure, and that's the worst part. It's about 25 seconds. Once we get the lip injected, we wait about 10 minutes, and then we get started. What we're really trying to do with a lip lift is remove 4 to 6 millimeters of skin, but keep the orbicularis oris muscle intact. Then what we do is we kind of elevate the skin around where we excised and then lift it up. And lip lift does something amazing with the white part of the lip, or the upper part of the lip, and then the red part of the lip. So for the upper part of the lip, it shortens it. And that's one of the biggest signs that we are aging, is that our lip gets longer here. So just shortening it allows us to look younger. The other thing that it does very nicely is show more of the red lip. So it almost looks like you had filler or a lip flip. And this is permanent without using a product. So a lip lift is really nice because it is permanent. Now you do still get bruising, and I like to keep the sutures in for 1 week and then take them out. So if you need to go to work, which you probably could, you either need to tell your coworkers that you had this done, or wear a mask. You definitely can eat and you can speak. You just have those sutures in place, and then it will get bruised right around here a little bit. That's the most common way we do it. There are lip lift procedures where we do it just on the corners of the lips and at the border of the red-white lip. Sometimes we're doing lip reduction procedures where we're rotating the lip inwards, upper or lower. And again, lip lift is really most commonly used for the upper lip, but we can do it on both. Lip flip, like we talked about, is only really for the upper lip, and lip filler is for upper and lower. So lots of different variations that we can do for the lips. First, for lip filler, that lasts about 6 to 18 months. Lip flip can last anywhere between 3 to 7 or 8 months, depending on the type. And then a lip lift is permanent. Lip flip gives you the least amount of post-op swelling and recovery time. Lip filler is a couple days worth of swelling and bruising, and lip lift is almost a week's worth of at least having the sutures intact, and maybe a couple days of swelling also and bruising. So I hope that helps.